Good morning everyone. Myself Sanjita Pandit. Welcome back to channel Medical with Sanju. Nepal Nursing Council's Set 21b remaining questions आज हामी डिस्कस गर्नेछौँ. So start गरौँ. Question number 76. A pregnant client at 8 weeks gestation is admitted to the hospital with vaginal bleeding, but no pain on vaginal examination. Cervical OS is closed. Which is the most likely tentative diagnosis? Option A, missed abortion. Option B, inevitable abortion. Option C, threatened abortion. And option D, incomplete abortion. Abortion means termination of pregnancy. Now, it is the expulsions or extractions of the embryo or fetus from its mother weighing 500 gram or less when it is not capable of independent survival. According to WHO, there is many type of abortion like spontaneous abortion, induced, threatened abortions, inevitable abortion, mixed, complete, incomplete, septic, legal, illegal. These all are the type of abortions. In missed abortion, बेबी को डेथ भइसकेको हुन्छ तर चाहिँ साइन सिम्पटम्स आइराखेको हुँदैन, त्यही भएर थाहा हुँदैन कि बेबीको डेथ भएको छ भन्ने. बट एन्ड इन इनिभिटेबल एबोर्सन, it is the clinical type of abortion where the changes have progressed to a state from where continuation of pregnancy is impossible. In this case, there is dilate cervix, heavy bleeding, low abdominal pain. In threatened abortion, there is continuation of pregnancy is possible. In this case, closed cervix, no bleeding, अथवा less bleeding, है ना, no pain, है ना, and OS is closed. And incomplete abortions means when the product of conception are expelled, not completely. Okay, so question number 76 indicate that this is threatened abortion. If there is no pain, no vaginal examinations should be done, there is a OS is closed, this is the indication of threatened abortion. Option C is right answer. Question number 77. What is the normal amount of amniotic fluid? Option A 800 to 1200 ml. Option B 500 to 800 ml. Option C 1200 to 1500 ml. And option D more than 2000 ml. Normal amount of amniotic fluid is 800 to 1200 ml. Option A is right answer. If the amniotic fluid is less than 800 ml, this case is known as a oligohydramnios. And if the amniotic fluid is more than 1200 ml, this case is known as a polyhydramnios. Question number 78. Medicines mifepristone and misoprostol is mainly used for. Option A surgical abortion, option B bleeding disorder, option C medical abortion, and option D premenstrual syndrome. The right answer is option C, medical abortions. Mifepristone, misoprostol, these all are the methotrexate. These all are used in medical abortion, MTP, medical termination of pregnancy. Question number 79. Which of the following is a common complication of breech delivery? Option A cord prolapse, option B preterm labor, option C PPH, and option D shoulder dystocia. The right answer is option A, cord prolapse is the common complication of breech delivery. Question number 80. Which of the following hormones functions to promote milk productions in mammals? Option A prolactin, option B vasopressin, option C thyroid hormone, and option D oxytocin. For the milk productions in mammals, the hormone prolactin. Option A is right answer. And for the ejections of milk, oxytocin. Question number 81. Which of the following circumstance is the most likely to cause uterine atony and lead to PPH, postpartum hemorrhage? Option A hypertension, option B cervical and vaginal tears, option C uterine retention, and option D endometriosis. Right answer is option C uterine retention. Question number 82. When assessing or laboring a client, the nurse find a prolapsed cord, The nurse should option A attempt to replace the cord, option B place the client on her left side, option C elevate the client hips, and option D cover the cord with a dry sterile gauze. यदि एउटा पेसेन्ट लेबरमा छ र एक्जामिनेसन गर्दा कर्ड प्रोल्याप्स्ड आएको छ भने फर्स्टमा के गर्नुपर्छ एलिभेट द क्लाइन्ट हिप अप्सन सी इज राइट आन्सर क्वेशन नम्बर 83 Partograph monitoring should be started when option A cervix is fully dilated, option B when cervical OS closed, option C when cervical dilation is 4 cm and option D when cervical dilation is 2 cm. When cervical dilation is 4 cm and then only partograph should be started. Option C is right answer. तर अहिले न्यू प्रोटोकलमा के भनेको छ कि 6 सेन्टिमिटर डाइलेट भएपछि मात्र स्टार्ट गर्नलाई तर यो रिटेन फर्ममा आएको छैन ओरली चाहिँ भनेको छ रिटेन फर्ममा आएको छैन त्यही भएर अहिलेसम्म 4 सेन्टिमिटर नै राइट छ क्वेशन नम्बर 84 A client is admitted to the labor and delivery unit. The nurse performed vaginal exam and determined that the client's cervix is 5 cm dilated with 75% effacement. Based on the nurse assessment, the client is which phase of labor? Option A active phase, option B latent phase, option C transitional phase, and option C yearly. There are 4 stages in labor: first stage, second stage, third stage, and fourth stage. In 4 stages, it is divided into 3 phase. First phase is latent phase, second phase active phase, and third phase transitional phase. In the latent phase, cervix dilated about 3 to 4 cm. This phase stays 6 to 8 hours. This phase started before the active phase. In active phase, cervix is most dilated. Started when the cervix about 4 cm with regular uterine contractions and up to 8 cm. In transitional phase, cervix dilated around 8 cm to 3 cm. In this question, there is 5 cm cervical dilation with 75% effacement. That means this is active phase. Option A is right answer. Question number 85. Sexual intercourse should be avoided in pregnancy when there is option A vaginal bleeding or leaking of fluid, option B preterm rupture of membrane, option C sexually transmitted disease, and option D all of the above. Option D all of the above. यो सबै केसमा सेक्सुअल इंटरकोर्स एभोइड गर्नुपर्छ. Question number 86. During fetal life, the blood vessels having maximum oxygenated blood is option A aorta, option B interior vena cava, option C pulmonary artery, and option D umbilical vein. 80% oxygenated blood is in umbilical cord. Umbilical vein. Option D is right answer. Question number 87. Which male structure make sperm? Option A penis, option B vas deferens, option C epididymis, and option D testis. Option D testis is right answer. Question number 88. Client with eclampsia begins to experience a seizure. Which of the following would the nurse in charge do first? Option A put the side rails, option B place a pillow under the left buttock, option C insert a paddle strong blade into the mouth, and option D maintain airway. Right answer is option D. Question number 89. If magnesium sulfate toxicity occurs, which medicines has to be administered as antidote? Option A calcium gluconate, option B protamine sulfate, option C naloxone, and option D acetylcysteine. The antidote of magnesium sulfate is calcium gluconate. Option A is right answer. Question number 90. A client makes a routine visit to the prenatal clinic. Although she is 40 weeks pregnant, the size of her uterus approximately died in an 18 to 20 weeks pregnancy. Doctor diagnosed gestational trophoblastic disease and orders ultrasonography. The nurse expert ultrasound 2 reveals option A, an empty gestational sac, option B, grape-like cluster, option C, a severely malformed fetus, and option D, an extrauterine pregnancy. The right answer is option B, grapes-like cluster. Question number 91. Normal labor is the process by which contractions of the gravid uterus except the fetus and the other product of conception. Option A, between 37 weeks and 42 weeks from the last menstruation period. Option B, before 37 weeks gestation. Option C, after 42 weeks gestation. And option D, after 24 weeks gestation. The right answer is option A. Question number 92. During prenatal visit at 4-month gestation, a pregnant client asks whether tests can be done to identify fetal abnormalities. Between 18 to 40 weeks gestations, which procedure is used to detect fetal anomalies? Option A, amniocentesis. Option B, chorionic villi sampling. Option C, fetoscope. Option D, USG ultrasound. Ultrasound. Option D is right answer. Question number 93. A nurse is assessing a client in the 4th stage of labor and note that the fonts is formed but that bleeding is excessive. The initial nursing actions would be which of the following? Option A, massage the fonts. Option B, place the mothers in the tenderbird's position. Option C, notify the physician. And option D, assess for cervical laceration. Assess for cervical laceration. Option D is right answer. Question number 94. A primiparous client who delivered a viable term neonatal vaginally 48 hours ago has a mild line episiotomy and repair of a 3rd degree laceration. When preparing the client for discharge, which of the following assessment would be the most important? Option A, constipation. Option B, rectal fistula. Option C, diarrhea. And option D, excessive bleeding. Constipation. Option A is right answer. Question number 95. What is the recommended daily pre-conceptual dose of folic acid? Option A, 4 mg. Option B, 0.4 mg. Option C, 4 gram. And option D, 0.4 gram. 0.4 mg. Option B is right answer. That means 400 mcg. Question number 96. After the first 4 months of pregnancy, the chief source of estrogen and progesterone is the option A, placenta, option B, adrenal cortex, option C, corpus luteum, and option D, anterior hypophysis. From conception to the 4 month, the main source of estrogen and progesterone is a corpus luteum. But after 4 months, the main source of estrogen and progesterone is placenta. Option is right answer. Question number 97. During which of the following phase of the menstruation cycle is it ideal for implementations of a fertilized egg to occur? Option A, secretory phase. Option B, ischemic phase. Option C, proliferative phase. And option D, menstrual phase. Secretory phase. Option A is right answer. Question number 98. Heartburn and flatulence common in second trimesters are most likely the result of which of the following? Option A, decreased gastric acidity. Option B, increased plasma acid levels. Option C, decreased intestinal motility. And option D, elevated estrogen level. These all are due to decreased gastric acidity. Option A is right answer. Question number 99. At pregnancy, uterus is in umbilical during option A, 20 weeks of gestation, option B, 24 weeks, option C, 18 weeks, and option D, 16 weeks. Right answer is option A. Question number 100. Preterm of labor means option A, before 37 weeks of gestation, Option B, before 35 weeks of gestation. Option C, after 38 weeks of gestation. And option D, 37 weeks to 40 weeks of gestation. The right answer is A. Before 37 weeks of gestation is called preterm labor. Question number 101. What is the complication of breech delivery? Option A, dry labor. Option B, fractured humerus. Option C, meconium aspiration. And option D, cephalohematoma. The complication of breech delivery is cephalohematoma. Option D is right answer. Question number 102. Which is the first fetal movement? Option A, fattening. Option B, quickening. Option C, fastening. Option D, lightening. The first fetal movement is a quickening. Option B is right answer. Question number 103. What is the probable sign of pregnancy? Option A, amenorrhea. Option B, nausea. Option C, decreased appetite. And option D, vomiting. डिफ्रेन्ट टाइप अफ साइन अफ प्रेग्नेन्सी अलरेडी डिस्कस भइसकेको छ डिस्क्रिप्सन बक्समा यसको लिंक शेयर गरिएको छ यदि यहाँहरूले चाहिँ हेर्नु भएको छैन भने चाहिँ ओपन गरेर हेर्न सक्नुहुन्छ योबाट प्रत्येक साल एउटा र दुईटा क्वेशन आइराखेको हुन्छ सो द राइट आन्सर इज ऑप्शन ए क्वेशन नंबर 104 soon after rupture of membrane what should be done option A measured FSH Option B, do PV examination. Option C, measured maternal BP. And option D, catheterized the mother. Immediately after rupture of membrane, first of all, to assess fetal heart rate. Option A is right answer, to measure FSH. Question number 105. Relation of long axis of a fetus to the long axis of uterus is option A, lie. Option B, presentation. Option C, abstraction and option D relation. You can see in this picture यहाँलाई डिफरेन्ट सोध्न सक्छ इन्गेजमेन्ट के हो डिसेन्ट के हो फ्ल्याक्सन एन्ड दे आर द मेकानिजम अफ लेबर जुन स्टेपहरु हुन्छ यो मध्ये र मोस्टली चाहिँ यो लाई प्रेजेन्टेसन हैन योहरु के हो भने चाहिँ सोध्न सक्छ सो लाई भनेको इट इज द रिलेशनशिप अफ द लङ एक्सिस अफ द fetus of the centralized uterus or the maternal spine and presentation means the part of the fetus which occupy is in the lower pole of the uterus and presenting part means it is defined as the part of the presentation which overlie the internal OS. What is attitude? Attitude means the relations of the different part of the fetus to one another. Denominator it is an arbitrary bony fixed point on the presenting part and position means it is the relations of the denominator to the different quadrant of the pelvis. So these all are the sometime सोधिराखेको क्वेशनहरु लाइक के हो प्रेजेन्टेसन को सो यो चाहिँ आउनु पर्छ यो क्वेशनको आन्सर अप्सन ए हुन्छ लङ एक्सिस मदर को र लङ एक्सिस फिटस को दैट मीन्स दिस इज लाई क्वेशन नंबर 106 The main route of a coronavirus infection is option A, droplet infection, option B, fecal-oral route, option C, transplacental route, and option C, vector-borne. This is droplet infection. Option A is right answer. Question number 107. COVID-19 disease is option A, sporadic, option B, endemic, option C, epidemic, and option D, pandemic. COVID-19 is a pandemic. Option D is right answer. Question number 108. The cases which occur irregularly, haphazardly, and infrequently is called option A, sporadic, option B, endemic, option C, epidemic, and option D, pandemic. This is sporadic. Option A is right answer. Immunization brings to which level of prevention? Option A, primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Immunization chapter पनि भइसकेको छ यो पनि भिडियोमा यहाँहरुले चाहिँ हेर्न सक्नुहुन्छ. Immunization is the Primary prevention. Option B is right answer. Question number 110. In AIDS patient, which of the following disease is common? Option A malaria, option B diabetic, option C typhoid, and option D TB. अक्सर यहाँले हेर्न सक्नुहुन्छ हस्पिटलहरुमा एआइडिएस भएको पेशेन्टलाई एड्स भएको पेशेन्टलाई मोस्टली टीबी भइराखेको हुन्छ सो द मोस्ट कमन डिजिज इज टीबी ऑप्शन डी इज राइट आंसर क्वेश्चन नंबर 111 wound healing is promoted by option A zinc iron copper and iodine मैक्सिमम क्वेशनहरुमा यहाँले हेर्नु भएको होला ओन्ली हिलिङ इज प्रोमोटेड बाइ प्रोटिन यसको बाहेक अरु पनि हुन्छ लाइक भिटामिन सी भिटामिन ए कपर जिंक यो सबै चाहिँ वुन्ड हिलिङमा हेल्प गर्छ दिएको अप्सन मध्ये सबभन्दा मोस्ट इम्पोर्टेन्ट भनेको जिंक हुन्छ अप्सन ए इज राइट आन्सर क्वेशन नम्बर 112 primary prevention is applied for option A sick person option B healthy person option C children and option D old person primary prevention is applied for healthy person option B is right answer question number 113 normally the date of measles vaccine is given option A 0.1 ml option B 10 ml option C 5 ml option C 5 ml and option D 0.5 ml यसको पनि क्लास भएको छ मेजल्सहरुको इम्युनाइजेसनको measles 0.05 ml दिन्छ option D is right answer question number 114 live attenuated vaccine is R option A BCG measles option C oral polio and option D all of the above The right answer is option D, all of the above. These all are the live attenuated vaccine. Question number 115. Which immunoglobulins passes to fetus through breast milk? Option A IgA, option B IgG, option C IgD, and option D IgM. IgA is the right answer. Question number 116. Oral vaccine is developed by option A Pasteur, option B Albert Sabin, option C Koch, and option D Scholl. The oral vaccine is developed by Albert Sabin in 1906 to 1993. Option B is right answer. Question number 117. Demography includes all except option A fertility, option B mortality, option C morbidity, option D social mobility and marriage. Demography include fertility, mortality, migration, social motility and marriage. Not include morbidity. Option C is right answer. Question number 118. Normal conversation produce a noise of option A 20 to 30 decibel, option B 60 to 80 decibel, option C 60 to 65 decibel, and option D 120 decibel. The right answer is option C 60 to 65 decibel. Whispering produce 20 to 30 decibel, normal 60 to 65 decibel, and habit traffic produce 60 to 80 decibel. Factories produce 120 decibel, tolerate up to 85 decibels, and permanent hearing loss 100 decibel मा हुन्छ र tympanic membrane rupture 160 decibel मा. Question 119. The waste which do not contain human excreta is known as option A scum, option B sewage, option C sludge, option D sewage. The right answer is option D sewage. Sewage means only liquid waste of a human excreta, and sewage means all liquid waste containing the human excreta also. Garbage means waste from kitchen. Rubbish means domestic refuse. like paper, clothing, and wood materials, etc. Refuse means solid waste from a street, house, and industry. Litter means a solid waste from a countryside. Question 120. Which form water is the purest form of water? Option A rain water, यहाँ rain water हुन्छ, spelling wrong भएको छ. Option B surface water, option C ground water, and option D spring water. The purest form of water is rain water. Option A is right answer. Question 121. What is the best method of solid waste disposal? Option A composting, option B incineration, option C dumping, option D sanitary landfill. The best method of a solid waste disposal is composting. Option A is right answer. Question 122. The best method of teaching an urban slum population about ORS is option A demonstration, option B lecture, option C role play, and option D flashcard. The right answer is demonstration. Option A. Question number 123. Chicken pox is caused by option A varicella virus, option B coronavirus, option C varicella virus, and option D retrovirus. Varicella virus. Option C is the right answer. Varicella virus. Question number 124. Goiter can be prevented by supplying option A iodized salt, option B pure sodium chloride, option C sodium fluoride, and option D KMnO4 plus NaCl. Goiter can be prevented by supplying ionized salt. Option is right answer. Question 125. Sunlight is the chief source of option A vitamin A, option B vitamin B complex, option C vitamin C, and option D vitamin D. Sunlight is the chief source of vitamin D. Question 126. Bile help in the digestion of option A fat, option B carbohydrate, option C protein, and option D alcohol. Bile help in the digestion of fat. Option A is right answer. Question 127. The first indicator of a PEM is option A overweight, anemia, option C poor musculature, and option D underweight. The first indicator of protein energy malnutrition is underweight. Option D is right answer. Question 128. Disease caused by novel coronavirus officially has a name. Option A COVID-19, option B NCP, option C Corona-19, option C coronavirus. COVID-19 option is right answer. Question 129. You are observing a 5-month World for Development skills. Which of the following skill would concern you if the infant has not demonstrating? Option A crawling, option B follow object with eyes, option C sitting with support, and option D grabs objects. The right answer is option D grabs object. Question number 130. Question 131. When developing plan care for a hospitalization child, nurse know that children in which age group are most likely to view illness as a punishment for mistakes. Option A infancy, option B preschool age, option C school age, and option D adolescence. The right answer is option B preschool age. Question number 132. A 20-year-old boy has fractured his arm because of a fall from his bike. After the injury has been casted, the nurse knows it is most important to perform all the following assessment on the area to the injury except. Right answer is option D, skin integrity. Question number 133. The nurse finds a 5-year-old boy having a grand mal seizures. What action should the nurse take first? Option A. Place a pillow under his head. Option B. Place a fatal tongue blade between his teeth. Option C. Straddle his leg and hold his arm. And option D. Call for help. Place a pillow under his head. Option A is right answer. Question 134. While assessing a 1-month-old infant, which findings should the nurse report immediately? Option A. Abdominal respiration. Option B. Irregular breathing rate. Option C. Inspiratory grunt. And option D. Increased heart rate with crying. Abdominal respiration, irregular breathing rate, increased heart rate with crying. These are normal symptoms in age group of 1 month, but inspiratory grunt is abnormal, so report immediately. Option C is right answer. Question number 135. The features of mild dehydration is option A. Sunken eyeball and thirsty. Option B. Depressed fontanelle and thirsty. Option C. Irritability and thirsty. And option D. Unconscious. Option C is right answer. Question number 136. Preschool children are age of option A 1 to 2 years, option B 2 to 3 years, option C 1 to 3 years, and option D 3 to 5 years. The right answer is option D 3 to 5 years. Question number 137. Dot 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 is a visible display of child's physical growth and development. Option A. Health to road chart. Option B. Road to health chart. Option C. Road to height chart. And option D. Road to weight chart. This is growth chart and this is a road to health chart. Option B is right answer. Question 138. At what age a child identify his or own sex? Option A 1 year, 1.5 years, 3 years, and 5 years. Option C is right answer, 3 years. Question 139. A child stands with support at the age of option A 6 months, option B 8 months, option C 10 months, and option D 1.5 years. Question number 140. In case of girls, the growth spurts start at the age of option A 8 to 10 years, option B 10 to 11 years, option C 12 to 30 years, option C 14 to 15 years. Right answer is option B 10 to 11 years. Question 141. Introduction of new food to the infant after 4 months of age is called option A weaning, option B weaning, option C dieting, and option D A and B both. After 6 month हुनुपर्छ यसको राइट आन्सर हुन्छ अप्सन ए विनिङ. Question 142. The body weight of a baby quadruples in option A 6 months, 1 year, 2 years, and 4 years. बेबी को वेट डबल हुन्छ 5 मन्थमा, ट्रिपल हुन्छ 12 मन्थमा, एन्ड क्वाड्रुप्लस हुन्छ 2 इयर्समा. Option C is right answer. Question 143. A nurse in the pediatric clinic is assessing an infant who had a revisions of a ventriculoperitoneal shunt. What clinical findings alerts the nurse that intracranial pressures has increased? Option A increased pulse rate. Option B hypoactive reflexes. Option C decreased blood pressure. And option D tensions of the anterior fontanelle. The right answer is option D, increased tensions of the anterior fontanelle. Question 144. A graphic representation structures of office with the job is called option A office chart, option B organogram, option C professional chart, and option D job description. This is organogram. Option B is right answer. Question 145. In the case of disaster, a nurse managers which leadership style is the best pursued. Option A democratic, option B autocratic, option C laissez-faire, and option D none of the above. Autocratic, option B is right answer. Question number 146. Nurse plans of assessing competent people to fill the roles designed in the hierarchy. Which process refers to this? Option A, staffing, scheduling, option C, recruitment, and option D, induction. Right answer is option A. Question number 147. Which of the following condition is demotivated? Option A, worse leadership. Option B, communication. Option C, culture encouragement. Option D, low salary. Worse leadership option is right answer. Question 148. X and Y theory of motivation is developed by option A, Frederick Herbert. Option B, Douglas M.C. Greger. Option C, Tyler. And option D, M.C. Farland. The right answer is option B. Question 149. Which one of the following is a mood disorder? Option A, somatoform disorder. Option B, schizophrenia. Option C, obsessive compulsive disorder. And option D, depression episode. The right answer is depression episode. Question number 150. Which of the following is not basic functions of management process? Option A, controlling. Option B, organizing. Option C, working. And option D, leading. The 5 essential functions of management are organizing, directing, planning, controlling, and leading. It not include working. Option C is right answer. Thank you so much and all the best for exam.